All right, let's dive right in. We're going to tackle a part of the Social Security disability process that, let's be honest, causes a ton of confusion and anxiety. I'm talking about the consultative exam. And by the time we're done here, my goal is to make this whole thing crystal clear for you.
When you're filing a disability claim, it can seriously feel like you're lost in a maze. I mean, you're already trying to manage a health condition, and then you're hit with all this paperwork and process. It's it's just overwhelming, and it's so easy to feel completely lost about what to do next. But here's the thing. Inside that maze, there is one single step that can literally be the deciding factor. I mean, the thing that determines whether your claim gets approved or denied. And that step is exactly what we're focusing on today. Because getting this part right, well, it's absolutely critical.
Okay, so let's get into it. What is a consultative examination, or a CE, as you'll often hear it called? You're probably thinking, wait, how is this any different from just going to my regular doctor? And you know what? That's the perfect question to ask, because the answer is the key to understanding this whole thing.
So a consultative exam, it's a medical evaluation, plain and simple. But, and this is the most crucial part, it is ordered by the Social Security Administration, and it's done by an independent medical professional that they hire. This is not your doctor. This is someone they've contracted with.
And this really breaks down that difference perfectly. Think about it. On one side, you've got your doctor, right? The person who provides your treatment, who you have a long-term relationship with. Then, on the other side, you've got the CE doctor. Their role? Totally different. They are an independent evaluator hired by the SSA for a one-time assessment. I'm going to say it again. They are not there to treat you.
And that right there, that brings us to the most important point of all, which is getting inside the SSA's head. What's their goal here? Why on earth are they sending you to this separate doctor in the first place? What are they really trying to figure out?
And this quote, man, it just gets right to the heart of it. The main goal isn't treatment. It's about gathering more objective medical evidence. That's it. It's all about the SSA getting more information, more evidence, so they can make a decision on your claim. It is purely about information gathering.
So what the SSA is trying to do is assess your current functional limitations. Now, that's just their fancy term for figuring out how your condition actually affects your day-to-day life. What can you do, what can't you do? And this whole evaluation is done for one reason and one reason only, to help them decide if you qualify for disability benefits. That's the whole game.
Okay, so we've covered what the exam is, and we've covered why the SSA orders it. But if you remember just one thing from everything we're talking about today, please let it be this. This is the single most important point. It's the central idea that really changes everything about how you should approach this. Here it is, simple as this. The mission is evaluation, not treatment. Evaluation, not treatment. When you walk into that exam room, if you can just keep that in your head, that this doctor's only job is to assess your limitations for a report, not to give you medical care, that is the key. It completely frames the entire interaction. Because at the end of the day, this exam creates a snapshot, a picture of your limitations that the SSA is going to look at to make a huge decision. So the real question becomes, now that you know its true purpose, how do you make sure that the picture they get is the clearest, most honest, and most accurate one possible?